So how we are going to assess the peptic ulcers? So what are the investigation procedures for the peptic ulcers? First one is going to be the investigations or the physical examinations. So is going to be the may reveal the pain. So especially, so the symptom, the pain will be in the epigastric regions, and also tenderness. Epigastrical region is going to be the tenderness. That means if you palpate and if you press in the epigastric regions, so the person is going to complain the pain, and also is going to the abdominal distension. So the person is going to get the abdominal distension because of the bloating. So it may use the abdominal distension, abdominal, the tummy bulge may chance to get because of the gastric gas accumulations. And also the investigation procedure is going to be is nothing but is a radiological investigation procedures such as the barium swallowing. So the barium swallowing is nothing but is going to be the small like pills are going to be swallow, or maybe pudding are going to be swallow. So this barium is going to be into the especially study for the pharynx, esophagus, and also stomach. So if they swallow this barium, so if you take the investigation procedures such as the radiological X-ray, and that's called as the fluoroscopy, so we can identify where exactly having the ulcer formations. So this barium studies is going to clear the upper, especially is going to be the upper GI tract. Upper GI tract means is a pharynx and also esophagus and also stomach and also small intestine. So this everything is called the upper gastrointestinal tract. So if any ulcers formation in the esophagus or stomach and duodenum, so we can find easily with this barium studies. So this going to be is a direct visualization of the inflammatory changes, ulcers, and also the lesions of the biopsy. So we are going to be identify with the barium swallowings. So with the barium swallowing, so is going to give the clear information, clear pictures we can identify in the this radiological investigations. So these barium investigations, so these gastric ulcers usually seen as round and also ovoid collection of the barium, but they can also be the linear or rod or star shaped. So these linear ulcers are often observed in the healing stages. So this going to depends upon the type or depends upon the shape of the appearance of these ulcers is going to give what type of the ulcers. Is it the acute ulcers, or maybe is the healing stage of the ulcers? So this especially is going to be it will be the linear or rod or star shaped appearance. So if the linear ulcers are observed commonly in the healing stage of the ulcers. Ulcers smaller than the 5 mm and also may not be detected in the barium studies. If the very small ulcers, so these barium studies are not going to be helpful. And also ulcers may vary from the 3 mm to the more than 5 centimeters. So these going to the giant ulcers are going to be above the 3 centimeters. So have the risks of the complications such as bleeding and also perforations. If it is more than 3 centimeters, so it is going to give the ulcerations and also the bleeding inside and also damage to the walls, and also is going to give the more perforations, more damage to in the intestines, especially in the small and duodenum as well as the gastric ulcers. So this barium is going to give the clear informations. And also another investigation procedures are the investigation of the stools. So that means that stool cultures. So this going to be especially for the H. pylori bacteria. So this going to periodically until they're negative for the occlude blood. So that means if any blood clot in the stools, or just now we discussed melena. So depends upon the type of the ulcers, especially in the duodenal ulcers, we are going to find that's a melena. The blood in the stools, we can find it. And also another investigation, that's the gastric secretory studies. So these gastric secretory studies are going to be identified. So we are going to diagnose with the eclohydria. So eclohydria means, so in case of especially in case of the gastric ulcers, so the gastric ulcers, the gastric secretion such as the HCl may chance to get like a less production of the HCl, or maybe normal productions. So if any less productions are is absence of the HCl concentration in the gastric juices, so it indicates the gastric ulcers. So there we can identify. And also in case of the chest conditions, that is the one type of the disease. So it's going to be if any infections or tumors in the intestine, small intestines, the tumors are going to be 1 or 2 tumors are going to be occurs in the small intestine. So these secretions are going to be absent in case of eclohydria, and also in the Jess. And also next one is we are going to investigation procedure is the H. pylori infections. So this one is going to be identified through the culture and also in the histology and biopsy. So different type of the, if you take the some tissues from the intestine, especially the stomach and also duodenum. So if we send to the histopathological labs, so we can find the, so if we send to the culture, so we are going to identify the H. pylori bacteria. So that also one of the investigation procedures. And also another test is the breath test. This is the simple test. So in this simple test, so we are going to identify this H. pylori infections. So these are this patient will swallow a pills, the small pills like small pills, or maybe liquid, or maybe pudding, some type of pudding, so that contain the carbon molecules. So these are going to be, if they swallow these like a pills, so who are having like H. pylori infections, so they may chance to release the carbon. So when the solution broke down into the stomach, so if we can identify easily with this breath test, so these are going to be like a small pills and also liquid, or maybe pudding I have to swallow. So these are going to detect the H. pylori bacteria. So these are going to find with these investigation procedures. So other than these things, and also we have to do the endoscopy. So with the endoscopy, we can send the flexible tube into the stomach through the mouth and also pharynx, esophagus and stomach and to the small intestine. So these things are going to be upper endoscopy. We are going to detect the where they're having the ulcer formation in the stomach. So with a small like a video guided tube, so this video guided tube is going to insert it into the mouth and the esophagus and stomach. So we can easily identify where they're having the like ulcers and what type of the ulcers we are going to identify.